Hello, everybody. My name is Enir Molov, and I will be giving you a presentation on role playing. However, we are going to be looking at role playing as not just a performance in a role or a play. We're going to examine this as a of an instructional teaching method that has somewhat of a complex understanding to it, but nevertheless, it can still be used for teaching, not only for entertainment. Okay, so here are our objectives. I'll just read over them real quick, but keep in mind throughout the whole presentation, these are the three main objectives I want you to take away from viewing this PowerPoint. So, one, list two major advantages and limitations of role playing by the end of the PowerPoint. Two, participate in a dramatization of role playing by the end of the PowerPoint. And three, demonstrate effective role playing by active involvement in the teaching learning process by the end of the PowerPoint. So, first, before we really get into depth into the various aspects of what role playing truly is, it's important to understand how we can describe this instructional teaching method, or in a sense, give a definition of what it encompasses or involves. So, what is role playing? Well, as I've already said, it's an instructional method. However, this method is used to teach by including the learner. The learner in a role playing situation actively participates in a dramatization, but unlike what we think of typical role playing, in, for example, a play, this type of role playing is an unrehearsed dramatization. So basically, we would ask the learner to be a participant and play an assigned part of a specific character, but we wouldn't give them a script. We would have them play that character by the way they think that he or she acts in a real life situation. So, to further describe role playing, it's a technique that is intended to specifically arouse some feeling or feelings in the learner that is participating in that role play, but also provoke some sort of emotional response in them. This type of role playing is not a script, it's a simulation. But enough information needs to be provided to the learner so that they can assume the correct role. And because it acts as a simulation, it gives the learner a real life situation to act out. So you might be asking, how does this help someone learn if they are making things up on the spot? Well, that's just it. Because they don't have a script, the learner can see how, and more importantly, why that character they are representing would act and behave the way they do in that real life situation, because they would be saying things that they think the actual person would say or feel. So, what does role playing do? Well, it helps the learner create and have an understanding of why people's behaviors are the way they are. For example, when applying this to a real life situation, we could have the learner put on some headphones. Now, depending on what type of scenario someone would want to do, um, in this one, we would just have the headphones function by just making it difficult for the individual to hear. Now, pretend that this individual is a nurse, for example. A lot of nurses work with the geriatric population, and because of this, nurses tend to encounter individuals that are hard of hearing. So, if a nurse put on those headphones and had another nurse or someone talk to her, she would be able to experience how it feels to not be able to hear when someone is trying to explain something to you, and that stress that goes with it. So, from these types of simulations, it helps the learner develop clinical judgment. Okay, so moving on, now we're going to talk about what domain of learning is appropriate for role playing. The domain that best fits would be the affective domain, or in other words, feeling domain. Because the participant in the simulation um, needs to discuss how they felt and share what understanding of interpersonal relationships they gained. This type of domain helps the learner understand their own attitudes, values, beliefs towards a particular situation. This domain is one of the three that is in Bloom's taxonomy, which is what is used to classify the levels of intellectual behavior important in learning. But it also provides an overview of cognitive skills ranging from lower order skills that require less cognitive processing to higher order skills that require deeper learning. So, in this feeling domain, there are categories that tell us what degree a person is emotionally responding to a situation. Are they receiving, responding, valuing, organizing, or characterizing that situation? Now, as an example of the affective domain, I'm going to use the hospital setting. Let's say that I asked a nurse to take the position of the patient, and then I told him or her to act the way she thinks a patient would. Then I would have others come in the room and act as doctors, giving her information about whatever disease she may have. Now, after going through this experience, the learner would be able to understand how the patient feels when doctor after doctor comes in and basically piles information on top of information. From this, if the scenario worked, the nurse would take away an appreciation for the patient that has to go through this and understand why a patient may break down after having to listen to doctor after doctor, but maybe not necessarily being able to take in all that information and then start feeling a little too overwhelmed. Okay, next we are moving on to the pros and cons of role playing. Some of the major pros or advantages of role playing would be that because of the emotional response to a particular scenario, it allows the professional to understand the client. It also bridges that gap between understanding and feeling, which in turn allows for a greater opportunity to explore various feelings and attitudes. However, there are some cons or limitations to using role playing, such as being only limited to the use of smaller groups. Also, some individuals do tend to exaggerate their assigned roles, which causes the simulation to be too dramatized, which unfortunately makes it lose its realness or credibility. Also, with people that are over the top, there are also those that may be uncomfortable in their role, which makes the dramatization not sufficient enough to help explore how that individual actually may feel when they are in that situation. But we can help with the comfort level of individuals by allowing each person that is to take part in that simulation to establish a rapport with one another. Now, for this slide, I'm going to provide some examples of how to use role playing in healthcare education of patients, peers, and student teaching. Okay, so for a patient teaching example, a nurse could use role playing by, for example, if the patient were a child, having the child use a puppet to explore their response to, for example, asthma, which is a very common childhood problem. Now, to use this method in peer healthcare education, one nurse could assume the role of someone that has cultural differences or is from another culture, and the other nurse could play the role of a nurse that is basically culturally incompetent. Now, after this simulation, they can each take a moment and talk about the important characteristics of that culture that they were depicting and why the other nurse's response may have not been appropriate for that specific culture. After doing this type of simulation, both nurses could walk away with the education of how to be culturally sensitive. Okay, so to wrap up these examples, I'm going to give an example of how to use role playing in healthcare education of students. Each student could start off by being assigned, for example, a patient, a doctor, a nurse, a supportive family member, or an unsupportive family member. As each student assumes the role after given some information about the role, um, they can act out how they would like that simulation to go ideally. For example, nurse and doctor would walk in to assess the patient, but one family member is very negative about the care that was provided, while the other is trying to focus on the patient and trying to be emotionally supportive for them. Now, after each person plays their role, the educator could ask them each how they felt about that unsupportive family member and each of their roles in the scenario, as the doctor, as the nurse, as the supportive family member, and share what could have been changed to improve patient care and satisfaction, as well as nursing satisfaction with that situation. I would also give them a chance to develop an understand. It would give them a chance to develop an understanding of behaviors and why people act the way and react the way they do. All right, we have reached the end of the presentation. So these are the references for the whole presentation. And I hope you have taken away some information about role playing. And looking back on the objectives that were presented in the beginning, now can meet them all with confidence. Thank you.